My warm greetings to one and all. Let us talk today's topic under biochemistry, that is principles of electrophoresis. On this, we can discuss regarding and we can identify regarding normal and abnormal electrophoretic patterns. What are the objectives of today's presentation? We have to know what is electrophoresis process, principles of electrophoresis, clinical uses of electrophoresis, and we can differentiate normal electrophoretic pattern and abnormal electrophoretic pattern. So let us define the topic of electrophoresis. Electrophoresis is defined as the migration of charged ions in an electric field. So what do you mean by electrophoresis? It is defined as the migration. What is the meaning of migration? Migration means movement of charged ions in an electric field. Another definition, electrophoresis is a general term which describes the migration and separation of charged particles or ions under the influence of an electric field. So okay, once again we can read this sentence. Electrophoresis is a general term which describes the migration. Migration means movement, air and separation of charged particles under the influence of an electric field. Application of electric field to the solution of ions makes ions to move. So whenever we apply any electric field to a solution of ions, so that ions will move from one area to the another area. Electrophoresis is the most commonly employed analytical technique for the separation of plasma or serum proteins. So what is the importance of this electrophoresis? By application of this electrophoresis, we can able to separate plasma or serum proteins. So let us talk about regarding principles of electrophoresis. When charged molecules are placed in an electric field, they migrate towards either the positive or negative pole according to their charge. For example, when charged molecules are placed in an electric field, they migrate. They move towards either the positive or negative pole according to their charge. For example, some of the ions will be charged under positively, and some are charged under negatively. So negative ions will move towards the positive side. Positive ions will move towards the negative pole. Proteins which can have either a net positive or net negative charge can migrate toward cathode or anode. An electrophoretic system consists of two electrodes of opposite charge, that is anode or cathode. The system consists of two compartments separated from each other by a partition. One side contains the anode and other the cathode. So when we see the machine of electrophoresis machine, it is consist of the majorly two compartments. So in this two compartment, one side it contain the anode and other side it contain the cathode. Each compartment is filled with a buffer. So this compartment, each compartment, it is filled with the buffer. So what kind of buffer we are using here? So barbital buffer of and which maintain the pH level of 8.6. It is often used for the separation of serum protein. So in the clinical area, whenever the clinical laboratory, if they are going to separate any serum protein, they are going to utilize the barbital buffer, and the buffer should has to manage the pH level is 8.6. The two compartments are connected by the support medium holding the sample, may for example serum, to be separated. So here what they are telling here, the two compartments are connected by a support medium. These two compartments are supported by a support medium and which holding the sample to be separated. When a current is applied to the system, the current is carried across the support medium, that is like porous membrane, by the buffer ions. We can repeat once again. When a current is applied to the system means the machine what we are using. So that when we are applying the current or electricity, we are creating electric field. The current is carried across the support medium by the buffer ions. So what kind of buffer we are using here? Barbital buffer, and it has to manage the pH level is 8.6. pH 8.6, all the serum proteins carry a net negative charge and tend to migrate toward the anode. Albumin carries the largest charge and therefore moves fast. Gamma globulin have the smallest net charge and move to the least distance. Depending upon the mode of operation and separation, electrophoresis is classified into various types. Let us talk about regarding clinical use of electrophoresis. The electrophoresis procedure is used in clinical laboratory for separation of serum proteins, lipoproteins, isoenzymes, hemoglobin, and other classes of macromolecules. Immunoelectrophoresis is used to determine specific classes of immunoglobulins. In our body, there is a different kind of immunoglobulin. To identify these immunoglobulins, they are going to perform the procedure of immunoelectrophoresis. Then, identification of antibodies to human immunodeficiency virus, that is HIV, is based on electrophoretic principle. How they are going to identify the antibodies belongs to HIV. That is like identification of antibodies to human immunodeficiency virus is based on electrophoretic principle. Identification of specific sequence of DNA used for prenatal diagnosis of inborn errors. So what do you mean by inborn errors? When the baby, before delivery of the baby, there is some kind of errors going to be identifying. That is known as inborn errors, which are diagnosed, which diagnosis of viral infections and identification of risk factors for cancer is also based on electrophoretic principle. Then let us talk about regarding normal electrophoretic pattern. So serum protein separated by electrophoresis, generally they have 5 bands. How many bands they have? Normal electrophoretic pattern, whenever we are observed, it having the 5 bands. So what are they? Albumin, alpha 1 globulin, alpha 2 globulin, beta globulin and gamma globulin. Gamma globulin have the smallest net charge and move the least distance. These 5 bands appear as 5 peak on the densitometer graph. Sorry, densitometer graph. A densitometer is a specialized calorimeter designed to scan and quantifies electrophoresis pattern. So we can identify abnormal electrophoretic pattern. How? The serum protein electrophoresis test measures specific proteins in the blood to identify some diseases. Serum protein electrophoretic patterns provide useful diagnostic information. Certain proteins in the blood may be elevated in infection or some other diseases. Different electrophoretic pattern of serum associated with various disorders compared with normal serum. Changes in serum protein fractions associated with various conditions are given below. So what are they? Infective hepatitis. Hepatitis, inflammation of the liver. So what kind of hepatitis? Infective hepatitis. Shows a slight decrease in albumin and significant increase in gamma globulin. If your patient is suffering with infective hepatitis, what kind of abnormal electrophoretic pattern can be detected? We can able to notify a slight decrease in albumin and significant increase in gamma globulin. And if your patient is suffering with liver cirrhosis, which shows elevation in beta and gamma globulin with a decrease in albumin. For example, if patient is suffering with the liver cirrhosis, if you perform this electrophoretic pattern, how the reading will show? It shows elevations in beta and gamma globulin with a decrease in albumin. In a similar way, the person is suffering with nephrosis, which shows low level of albumin, significantly elevated alpha 2 globulin and elevated beta globulin. Now you understood this. So based on the condition, the we can detect the abnormal electrophoretic patterns. So whereas in the nephrosis condition, what will happen? Nephrosis, it is a kidney abnormality which shows the low level of albumin, significantly elevated alpha 2 globulin and elevated beta globulin. And other condition is multiple myeloma. This multiple myeloma shows marked increase in gamma globulin. Now we can see once again here the metion which is this is considering as a electrophoretic metion. Normal pattern of plasma protein in electrophoresis. When they are recording the electrophoresis pattern normally, so they are, as we discussed that every pattern having 5 bands will be there. That is albumin, alpha 1 globulin, alpha 2 globulin, beta globulin and gamma globulin. Now you can see this how the elevation of the structure will be notifying. If it is the electrophoretic normal pattern, it is showing this kind of pattern will be notifying, and we can see one side positive charge, another side negative charge will be recording. And this is also a normal pattern we can notify here. From the book I have gathered this picture: albumin, alpha 1, alpha 2, beta and gamma. So what they are showing here? Point of application. What is the heading of the picture? Electrophotogram of normal serum on cellulose acetate strip. Then picture B is showing densitometric scanning from cellulose acetate strip converts bands to categories peaks of albumin, alpha 1 globulin, alpha 2 globulin, beta globulin and gamma globulin. Electrophoretic separation of serum protein. We can notify this. This is the normal pattern. Whereas abnormal pattern, and here also the first picture is explaining regarding normal pattern. If the patient is suffering with nephrosis, the pattern will be little bit different. And multiple myeloma, here multiple myeloma condition also there is the pattern will be different. And here infectious hepatitis, there is also raising of the albumin, but again we can notifying here. Again, the gamma globulin will be raising, and in this condition also raising of the gamma globulin, and here multiple myeloma gamma globulin raising will be notifying, and nephrosis condition we can notify alpha 2 and then beta globulin will be raising. Now when you differentiate between normal pattern and abnormal pattern, we can able to identify the how the electrophoresis will be useful in the clinical scenario. And this is a time for summarize our topic. Till now we have discussed regarding electrophoresis. It is defined as the migration of charged ions in an electric field. What is the purpose of this? For separation of plasma proteins from the blood. And we have discussed regarding some of the principles of electrophoresis, and we have discussed regarding clinical use of electrophoresis, and we differentiate what is a normal electrophoretic pattern and what is the abnormal electrophoretic pattern with different disease conditions. I hope my dear students you understood this concept of electrophoresis and its benefits or its principles and clinical uses in the patient care. So thank you one and all. Once again we'll meet